What is going on, everybody? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my Microbiology and Infectious Diseases playlist. In previous videos, we talked about bacterial infections, including those caused by gram-positive bacteria and those caused by gram-negative bacteria. Today, we shall turn our attention to diseases caused by viruses. Today's topic is measles, also known as rubeola, which is caused by the measles virus. Please do not confuse measles with German measles. The two are not the same. Measles can affect the young and the old. Contrary to popular belief, measles tend to be more severe in adults compared to their younger counterparts. And while the rash of measles is usually self-limiting, the problem happens if you suffer one of the nasty complications of measles, such as giant cell pneumonia, post-infectious encephalitis, and subacute sclerosing panencephalitis, which can arise even years after you recover from the rash. Click the like button, click the subscribe button before my eyes turn red. How old is measles? Older than Croesus. Here's the gentle historian describing the Hippocratic era in ancient Greece. Quote, "The weakest point in Hippocratic medicine was diagnosis. There was apparently no taking of the pulse. Fever was judged by simple touch, and auscultation was direct, meaning the physician used to put his ears directly onto the patient's chest. And this was called immediate auscultation. But today's auscultation is different. Today's auscultation is known as mediate auscultation because there is a mediator, the stethoscope, between your ears and the patient's body. Infection was understood in the case of scabies, ophthalmia, and phthisis. By the way, phthisis means wasting. In this case, it's referring to tuberculosis, which is known as phthisis pulmonalis, the wasting of the lungs. You can watch my video on tuberculosis in this Microbiology and Infectious Diseases playlist. The corpus contains excellent clinical pictures of epilepsy, epidemic parotitis, puerperal septicemia, we call this today peripartum sepsis, which has killed many mothers throughout history during childbirth, and quotidian, tertian, and quartan fevers. See my video on malaria in this same playlist. There is no mention in the collection of smallpox, measles, diphtheria, scarlet fever, or syphilis, and no clear mention of typhoid fever. The treatises on regimen move toward preventative medicine by advocating pro-diagnosis, an attempt to catch the first symptoms of a disease and to nip it in the bud. Hippocrates was particularly fond of prognosis. The good physician, he believed, will learn by experience to foresee the effects of various bodily conditions and be able to predict from the first stages of a disease the course that it will follow." Unquote. This was the era of ancient Greece. But how about the medieval period? Here's the same dude writing about the Islamic Golden Age. Quote, "The Muslims established the first apothecary shops and dispensaries, founded the first medieval school of pharmacy, and wrote great treatises on pharmacology. Muslim physicians were enthusiastic advocates of the bath, especially in fevers and in the form of steam bath. Their directions for the treatment of smallpox and measles could scarcely be bettered today. Anesthesia by inhalation was practiced in some surgical operations. Hashish and other drugs were used to induce deep sleep, which is a topic for another video. See my pharmacology playlist. We know of 34 hospitals established in Islam in this period. So from this, we know that measles is as old as antiquity. And so are many diseases. Because in today's age, there are some low lives on social media claiming that every single disease that you can imagine is caused by microplastics, fluoride in the water, air pollutions, or big corporations. And while these things might not be entirely harmless, I'm here to show you that many of these diseases are very old indeed. But this is not just true for infectious diseases. The same holds true for cancers and autoimmune diseases. And instead of going down this rabbit hole, if you just get off your butt, go to the library, crack a mean history book open, you would realize that whether you lived in the ancient age, the medieval age, or the modern age, pathology will always kick your butt. Pathology always has the last laugh. and it shall follow your gluteus maximus to the grave. So chill, it's not that deep. Go eat your vegetables. Today we're talking microbiology, but what does that even mean? Ology means the study of, bio means life, micro means small. So microbiology is the study of small life. If you wish to see more videos like this in the future, please drop a microorganism emoji in the comments. We can divide microbes into bacteria, fungi, viruses, and parasites. But to be fair, parasites, some of them are very big, macroscopic rather than microscopic. And to be fair, viruses could be considered as non-living entities and not microbes. So we call them agents rather than microbes. And that's why the study of microbiology is subdivided into bacteriology, fungology or mycology, virology, and parasitology. But we need to organize our thoughts. So how did we classify a bacteria? Using the gram stain into gram-positive bacteria and gram-negative bacteria. Gram-positive bacteria appear purple, but gram-negative bacteria appear pink using the gram stain. This G in gram has to be capitalized. It has to be uppercase because this is the name of the scientist who described this technique. And then the gram-positive bacteria are further subdivided into cocci and rods. Same thing with the gram-negative bacteria, cocci and rods. Now let's talk about viruses. We are here. Bacteria, fungi, and parasites are in one land, and viruses exist in a totally different world. What do I mean by this? Bacteria, fungi, and parasites are all living cells, meaning they can replicate independently, they can make their own proteins, they can produce their own energy, and they can be seen by a light microscope. But viruses are very different. Viruses are not even living cells. They cannot replicate independently. They depend on you. They have to hijack your cell and exploit your nuclear machinery in order to replicate. Viruses cannot make their own proteins on their own. They cannot make their own energy, and they cannot be seen by a light microscope. Viruses are not actual cells. Why not? Because remember, in biology, we had the 4 fundamental tenets of cell theory. The cell has to be a unit of life, arise from pre-existing cells and replicate independently, and carry the genetic info in the form of DNA. But viruses are different. For example, viruses could be DNA viruses or RNA viruses. Viruses are not considered as living organisms. Some textbooks describe them at the edge between life and non-life. They lack cellular structures, such as the ribosomes, the endoplasmic reticulum, the mitochondria, the Golgi apparatus, etc. These are small infectious agents rather than microorganisms. First discovered and described in 1892, they are transmitted via vectors. They replicate very quickly. That's why everyone is trying to go viral and no one is trying to go bacterial. Viruses cannot replicate independently, but rather they have to hijack your own nucleus and harness your DNA-making machine. Many viruses infect your lymphocytes, such as HIV virus and such as measles, which is today's topic. Cells versus viruses. Cells can replicate by mitosis or binary fission. Viruses said, nope, not doing this. Cells have a cell membrane by definition. Viruses do not have a cell membrane. Some of them have an envelope, some of them do not have an envelope. Your cells have both DNA and RNA. Each one of your cells has both DNA and RNA. However, viruses can have DNA only or RNA only, not both of them. Cells can make proteins, and we have tons of proteins in the cells, such as actin, such as tubulin, such as keratin, such as DNA polymerase, RNA polymerase, ATP synthase, hexokinase, lactate dehydrogenase, channels, which are proteins, pumps, which are proteins, carriers, which are proteins, enzymes, many of them are proteins, and much more. But in viruses, very few proteins exist. Cells have ribosomes. Viruses do not, except arenavirus, which has a ribosome that is non-functioning. Your cells have mitochondria, with the exception of the mature red blood cell, which does not have a mitochondrion. Viruses do not have mitochondria, which means they cannot make their own ATP. They cannot produce their own energy. Cells have many enzymes. Just open any biochemistry textbook and you will feel dizzy. But in viruses, enzymes are very few or non-existent. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. So, a virus can either has DNA or RNA. So we divide viruses into DNA viruses or RNA viruses. Remember, bacteria were divided into gram-positive versus gram-negative. But viruses are divided into DNA viruses versus RNA viruses. Viruses have a protective protein coat. This is known as a capsid. Next, some viruses have an envelope, others do not have an envelope. Viruses do not have a nucleus, do not have a cytoplasm, do not have mitochondria, do not have ribosomes with one exception. They have very few proteins and very few enzymes. Viruses cannot produce energy or make proteins, and therefore they cannot replicate outside the cell. Therefore, they are dependent on your cellular machinery. Therefore, they have to be inside the host cell in order to replicate. So in that sense, we can think of viruses as obligate intracellular parasitic agents because they exhibit parasitic behavior. But this is not what we study in parasitology. Parasitology usually focuses on the helminths and the protozoa, not the viruses. However, viruses exhibit parasitic behavior, and now you understand why. So we divide viruses into DNA viruses and RNA viruses. If you are a student, these are the viruses that you need to know. But of course, if you have a PhD in microbiology, you need to know way more than this. So what are the DNA viruses that you need to know? Please sing with me. This song is from Help Hippo. The song for DNA viruses goes like this. Pox, herpes, hepatina, parvpep, polyadena. Pox, herpes, hepatina, parvpep, polyadena. The first line has enveloped viruses, but the second line, these viruses are non-enveloped, sometimes known as naked viruses, meaning inappropriate and not family-friendly. How about the RNA viruses? It also has a song. The song goes like this. Toga flavi and retro, corona delta arena bonifilo, rhabdo ortho and paramyxo, picellisi hepureo. Again, the last line has no envelope. Quick tips for students. Sometimes your professor is going to ask you, hey, tell me about the Hepadinaviridie family of viruses. Do you think it's DNA or RNA? Well, look at the name. It literally has DNA in the name. So by definition, this is a DNA virus. Again, here is another one that's very similar. How about Picornaviridae? As a family of viruses, it has RNA in the name. So this is an RNA virus. Another trick for students. If the family of viruses starts with an R, as in Retroviridae, Rhabdoviridae, and Reoviridae, therefore they are RNA viruses. But if you look at the DNA viruses, none of these families start with an R. So, microbes include bacteria, fungi, viruses, and parasites. The viruses are subdivided into DNA and RNA viruses. The DNA viruses could be enveloped or non-enveloped. The enveloped DNA viruses include poxviridae, herpesviridae, or the herpes family of viruses, and hepadinaviridae. All of these are the names of families of viruses. What is a family? Remember, biology goes like this. This is the taxonomy in biology. You go kingdom, phylum, class, order, family, genus, species. Kingdom, phylum, class, order, family, genus, species. These are the names of families of viruses. And each family will have a bunch of genera and a bunch of species. Guys, please, the plural of genus is genera, not genuses. Don't make that mistake because it drives me insane. Indeed, more insane than Friedrich Nietzsche after he contracted tertiary syphilis. See my video on syphilis in this microbiology playlist. Next, non-enveloped DNA viruses. What are the names of the families? Parvoviridae, Papillomaviridae, Poliomaviridae, and Adenoviridae. Next, the RNA viruses are also subdivided into enveloped and non-enveloped RNA viruses. The enveloped ones include Togaviridae, Flaviviridae, Retroviridae, Coronaviridae, Deltaviridae, Arenaviridae, Buniaviridae, Filoviridae, Rhabdoviridae, Orthomyxoviridae, and Paramyxoviridae. Today we are talking about measles, which is a member of the paramyxoviridae family of RNA viruses. The non-enveloped RNA viruses include Picornaviridae, Calliciviridae, Hepiviridae, and Reoviridae. So we agreed that viruses are divided into DNA viruses and RNA viruses. Each one could be enveloped or non-enveloped. And then what? The enveloped RNA viruses could be single-stranded RNA viruses or double-stranded RNA viruses? If you are double-stranded RNA virus, then by definition you have both. What do I mean by both? I mean you have a positive strand and a negative strand together because you're double-stranded. So in that sense, you're ambisense. However, if you are a single-stranded RNA virus, you can either be a positive sense or a negative sense, not both of them together. You are not ambiguous with both, you are distinct with either or. Both the orthomyxoviridae and the paramyxoviridae family of viruses are negative sense, single-stranded, enveloped RNA viruses. That's some good taxonomy right there. I should have become a taxonomist. Here's a quick comparison between orthomyxoviridae and paramyxoviridae. What do these two have in common? As we have said in the previous slide, both of them are viruses, both of them are RNA viruses, both of them are enveloped RNA viruses, both of them are single-stranded RNA viruses, and both of them are negative sense RNA viruses. But what's the difference between orthomyxoviridae and paramyxoviridae? Orthomyxo is smaller, paramyxo is larger. Orthomyxo family has segmented genome, but the paramyxo family has non-segmented genome. Does anyone remember the influenza virus? Of course, how can we forget? The influenza virus is an orthomyxo virus. How about measles virus, which is today's topic? The measles virus belongs to the paramyxoviridae. Now I want you to pause the video, and in each one of these lines I want you to choose the correct answer that describes the paramyxoviridae family of viruses. First of all, are there bacteria, are there fungi, are there viruses, or are they considered to be parasites? Do they have an envelope or no? Is the capsid of the nucleus helical or is it icosahedral? Is the genetic material DNA or RNA? Are these considered single-stranded or double-stranded? How about the sense? Are they positive sense, negative sense, or both? How about the genome? Is it segmented or non-segmented? Is it linear or is it circular? Pause the video and choose one answer in each line. Now pause, and here are the answers. Paramyxoviridae, of course, viruses, hence viridae. These viruses are enveloped. The nucleocapsid is helical. It's an RNA virus, single-stranded, negative sense, non-segmented, and linear. Who else is gonna teach you like this? Your professor with his PowerPoint? Give me a break. Again, microbes are bacteria, fungi, viruses, or parasites. Viruses could be DNA or RNA, each one of which could be enveloped or non-enveloped. Enveloped RNA viruses could be single-stranded or double-stranded. Today's topic is a negative sense, single-stranded, enveloped RNA virus. We're talking about the paramyxoviridae family of viruses. After the family, how about the genera? Oh, the genera include morbilliviruses, paramyxovirus, and pneumovirus. The measles is a morbillivirus. The para-influenza is paramyxo. I mean, look at the mnemonic. Para-influenza is paramyxo. It cannot get easier than this. How about mumps? Mumps also has a P, so you can think about it as paramyxo. You cannot just lump mumps and measles together in the same genus. That's just illegal. The two diseases are not the same. I mean, one destroys your lungs, the other destroys your testicles. This one does not cause arthritis, this one does. This one does not cause deafness, this one does. This one does not cause parotitis, this one does. This one does not cause pancreatitis, this one does. This one does not cause orchitis, which is inflammation of the testicles, this one does. This one does not cause oophoritis, inflammation of the ovaries, but this one does. This one does not cause myocarditis, this one does. This does not cause glomerulonephritis, this one does. This one does not cause arthritis, this one does. When I say does not cause, I mean it's very unlikely, but not impossible. In pathology, everything is possible. Pathology, by definition, does not care about your stupid rules or pigeonholes. Pathology just kicks butts. Next, imagine that you were a young lad and went to a daycare center, which is just an enlarged petri dish. Kids are nasty, microbiologically speaking. They put their hands in their mouths, they put toys in their mouths, they spit on each other, they vomit on each other, they eat poop, they do crazy stuff. But how is measles transmitted? The answer is via respiratory droplets. The droplets are going to reach your respiratory system. The virus is going to infect the monocytes or the lymphocytes and then spread through the lymphatic system. But how does the virus spread from one cell to another? Here's the story. It's a very, very, very complicated story which deserves its own video, but here I'll just summarize it. If you want the story in greater detail, please comment below and I will make a video just on the pathogenesis of measles. Starting with the measles virus itself, which is an RNA virus. It has an envelope and it has a bunch of proteins, as you see. There are many proteins on the measles virus, including hemagglutinin or hemagglutinin neuraminidase and or G protein. Where are they located? On the envelope of the measles virus. Okay, and then what? These proteins are gonna help the virus enter into your cell and hijack your own cell. What kind of cell are we talking? I'm talking about your monocyte or your lymphocyte. Oh, these are immune cells. These are white blood cells. This is true. Next, what's the name of the receptor that's gonna let the measles into my cell? Well, there are many receptors, including sialic acid, including MCP, which stands for membrane cofactor protein. And as you know, in pathology, almost every protein has an ID number. We call it CD, cluster of differentiation. And how do we know these numbers? You can do flow cytometry to know whether this is CD46, CD19, or whatever. Another receptor waiting for the measles is the SLAM, which stands for signaling lymphocyte activation molecule. This one is CD150. Okay, now measles is inside my own cell. Measles is a negative sense RNA virus. Okay, listen to me carefully. If you, as a virus, is positive sense, which measles is not, you are very similar to the messenger RNA or mRNA that we all know and love, meaning you can be directly translated into proteins and boom, we're done. But if you are like measles, a negative sense RNA virus, therefore you cannot be directly translated into proteins. Oh, what should I do then? First, you need to be transcribed, #transcription, into a positive sense or a positive template RNA by the famous enzyme known as RNA-dependent RNA polymerase, because I start with an RNA and I end up with an RNA. So it's RNA-dependent RNA polymerase, making polymers. And this is exactly what happens here. You need to be transcribed first, and then you're going to give me the mRNA, i.e. the template with a positive RNA, and after this, you make proteins. This is called protein synthesis or translation. So transcription first, then translation. Then you assemble the genetic material and the proteins, and you make another virus. This is another measles virus ready to infect another cell of your own. How does it jump from one cell to another? By cell-to-cell fusion, because measles has a fusion protein, or F protein for short. Now this can lead to many of your cells fusing together, forming one huge giant cell. We call this multinucleated giant cell. And your cells will act together as if they are one unit, called syncytium. And this phenomenon is called syncytia formation. And this is how measles spread from one cell to another. Be careful, measles does not kill your cell after it exits your cell. So measles is very polite indeed. However, HIV is the opposite. HIV virus is gonna destroy your lymphocyte as it exits. Next, we'll talk about the clinical picture of measles, signs and symptoms, and this is the timeline, so we're going to talk about them in order. So the virus enters my body here. This is day 0. Then there is an incubation period. What's the incubation period, please? It's the time between the moment of infection and the beginning of symptoms. In measles, the incubation period lasts about 7 to 13 days. Then we start the symptoms, which include 3 C's and 1 P. The 3 C's are cough, coryza, conjunctivitis. What is coryza? It's a fancy schmancy way of describing rhinitis. So cough, we know that. Coryza is rhinitis or inflammation of the nose. Then conjunctivitis, inflammation of the conjunctiva. This can lead to a pink eye or a red eye. Photophobia is fear of vision, which could be caused by the conjunctivitis. And then what do we get? We get respiratory symptoms. The virus starts to appear in the blood. We call this viremia. Then we find the virus in the respiratory tract and in the urine, so you can take a sample from the patient's respiratory tract and then send this to the lab. We can do many tests in the lab, including PCR, which is very accurate. And at that moment, you can also find the virus in the urine. Then, the famous Koplik spot. What's the Koplik spot? It's a white spot or white bluish spot on an erythematous background or on a red background. Then, after the Koplik spot, we have the rash. The rash starts within 12 to 24 hours of the appearance of the Koplik spot, so they are very closely related. Let me tell you something about the Koplik spot. Unfortunately, most doctors think that the Koplik spot only exists in the mucosa of the oral cavity, but that's not true. We can find Koplik spots inside the mouth, on the conjunctiva, or in the vaginal canal. I mean, when was the last time you ever saw a pediatrician examining the conjunctiva for a Koplik spot? And then you wonder why many patients do not trust doctors anymore, because most doctors are doofuses, and they have been taught by a bunch of miserable, frustrated mediocrities, aka professors, and that's why you need a medicosis in your life. And then after this, what's gonna happen? The bad stuff. Post-infectious encephalitis, which means inflammation of the brain substance after the measles infection. And years later, years after the rash of measles, some patients can suffer from subacute sclerosing panencephalitis. Let's break that down. Encephalitis means inflammation of the brain substance. Pan means extensive, inclusive, all of the brain. Sclerosis means hardening. Subacute means it's not acute and it's not chronic. It's somewhere in between. Let me tell you something. Pathology in the brain is called encephalopathy. Pathology in the spinal cord is called myelopathy. Inflammation of the brain is encephalitis. Inflammation of the spinal cord is myelitis, as in transverse myelitis. How about inflammation of the meninges that cover the brain and the spinal cord? The answer is meningitis. Inflammation of the cerebrum only, not the entire brain, cerebritis. A collection of pus in the brain, brain abscess. A collection of pus in the cerebrum, cerebral abscess. So, pathology of the spinal cord is myelopathy. How about pathology of the peripheral nerve, peripheral neuropathy? But how about a pathology in the nerve root as it exits out of the spinal cord? This is radiculopathy. And just like we have cranial nerves and spinal nerves, we have cranial radiculopathy and spinal radiculopathy. Are you familiar with disc herniation that can lead to sciatica? Well, this is an example of spinal radiculopathy. Hey, in cases of sciatica, which nerve root or roots are compressed? If you know the answer, comment below. But be careful, because when doctors say cranial radiculopathy, they usually mean cervical radiculopathy, which is part of the spinal cord, not necessarily the brain. Okay, what if the pathology is in the muscle? Myopathy. What if we have inflammation of the muscle? That will be a myositis. See, medicine makes so much sense once you understand what the flip you're talking about. Can measles cause encephalitis? Absolutely yes. Is it common? No, it's not. What are the names of the spots that we see in measles? They are the Koplik spots. Quiz time. Spots in medicine. So the Koplik spot is the one that we see in measles. We see it on the buccal mucosa, in the conjunctiva or vaginal canal. The blind spot is not a disease. This is the physiological blind spot when the optic nerve pierces the retina. Let's see how good of a clinician are you. Out of these 23 spots in medicine, how many did you actually know? Without cheating, please comment below and let me know. Let's talk about the rash of measles, or the measles exanthem. By the way, what's the difference between the word exanthem and the term enanthem with an N instead of an X? If you know the answer, comment below. Before we talk about the rash of the measles, let me tell you that when the rash starts, we begin to see IgM in the patient's blood, and you can do ELISA to discover that. The rash of the measles is known as rubeola, not to be confused with rubella or German measles. The rash of measles occurs within 24 hours of the appearance of the Koplik spots. The rash of the measles is caused not by the virus per se, but by your response to the virus, caused by your T cells targeting the virus-infected endothelial cells that line the small vessels. And that's why, if you're immunocompromised, whether it's congenital immunodeficiency, such as SCID or severe combined immunodeficiency, whether it's acquired immunodeficiency, such as HIV/AIDS, or whether it's iatrogenic immunodeficiency caused by the doctor giving you immunosuppressive drugs because you're an organ transplant recipient, for instance. Regardless of the cause, if you are immunosuppressed or immunocompromised, you might get the measles without the rash. How come? Because you do not have sufficient T-cell response against the virus. So you will be infected with the virus, but you will not suffer the rash. Next, the rash is maculopapular. A macule is a flat skin lesion. A papule is a raised or elevated skin lesion. Macule looks like this, papule looks like that. These rashes are going to coalesce together or join together to become confluent. The measles rash starts below the ear, and then within 1 or 2 days it spreads all over the body. So it starts here and spreads here. The day the rash starts is the worst. Why? Because the fever is going to be the highest and the patient will be the sickest at that moment. The rash started up and then spread downwards. It's going to fade or disappear in the same order. It disappears up first and then disappears downwards. The rash is not what's dangerous about measles. Most patients recover from the rash and then they develop lifelong immunity against measles. But hey, medicosis, since most patients recover, I can just skip the vaccine, right? Well, be careful. The rash is not the big deal. However, there are some nasty measles complications that can happen. They are rare, but they do happen and they can be deadly. These complications include giant cell pneumonia or pneumonia with giant cells. Why giant cells? Because of the cell-cell fusion. Because measles jumps from one cell to the next cell and then fuses them together, and then to another cell and then fuse them together, and then to a fourth cell and a fifth cell until you end up with a multinucleated giant cell. The most common cause of death from measles is pneumonia. This pneumonia is caused by a virus, the measles virus. On top of that, you can develop a secondary bacterial infection known as bacterial superinfection. For example, I can start with measles, which is a viral infection, followed by Staph aureus, a bacterial infection, on top of the measles infection. Diarrhea can happen post-infectious encephalitis and the subacute sclerosing panencephalitis. These are bad. And speaking of deadly complications, do you want to learn about myocardial infarction, strokes, cardiac arrhythmias, ARDS, acute limb ischemia, drowning, the toxidromes, and more? Download my emergency medicine high yields course at medicosisperfectionalis.com. It comes with videos, notes, and cases. Let's talk about the classic childhood red rashes. We have many diseases that can lead to red rash in children, including rubeola or measles, rubella or German measles, varicella or chickenpox, scarlet fever caused by group A beta hemolytic streptococcus, also known as Streptococcus pyogenes, erythema infectiosum, also known as the fifth disease, HHV6, which is human herpes virus number 6, this is roseola or roseola infantum, and then 7 is hand-foot-mouth disease caused by Coxsackie-A virus. Hey, what's the name of the heart disease or diseases caused by Coxsackie virus? If you know the answer, comment below. Measles and immunity. If you have weak immunity, again, whether it's caused by congenital immunodeficiency, acquired immunodeficiency, or iatrogenic immunosuppression, you're at higher risk of measles infection and at a higher risk of measles complication. But you are less likely to develop the rash of measles because the measles rash is caused not by the virus per se, but by your T-cell response against the virus. And if your T-cell response is poor, you're less likely to develop a rash. Next, if you are vitamin A deficient and malnourished, you are toast. You are at a higher risk of a more severe measles infection. But what does measles have to do with vitamin A? To learn more about this, please watch my video titled Vitamin A in my biochemistry playlist. Vitamin A is just a doozy. Unless you're pregnant, then it's evil. Now let's compare between children and adults. As you know, children on average has a weaker immune system, and that's why children are more likely to get infected with measles, but they are less likely to develop a rash. Therefore, their clinical picture is less severe when you compare them to their adult counterparts. So, in adults, measles infection is rare, but if it happens, it's going to be more severe compared to children's measles. So, to recap, in children, measles is more common but less severe, but in adults, measles is less common but more severe. How can we diagnose measles? The best is RT-PCR or reverse transcriptase PCR, polymerase chain reaction. Where do you get the sample? From the respiratory system. You can also do serology, which is the scientific study of the serum. What am I looking for? IgM in the serum, which starts to be noticed in the serum when the rash starts. If you do a biopsy, which is not necessary, of course you'll find the giant cells, usually with reactive hyperplasia in the lymph nodes. So measles can lead to lymphadenitis or inflammation of lymph nodes. How can we treat measles? Well, of course, prevention is better than cure, but let's say that I was not vaccinated, or I was very unlucky that I contracted measles before the vaccine schedule, before I was old enough to receive the vaccine, because the first dose of the MMR vaccine is usually given around 12 to 15 months of age. But I can get measles earlier than that. So, what should we do then? We give vitamin A. This is very important. Vitamin A is very important for the immune system. What else? You can also give immunoglobulins. These are antibodies that will help the baby fight the infection. Immunoglobulin is particularly important if the patient is immunocompromised, such as in severe combined immunodeficiency. If we see complications, we treat them. And for adults with severe infection, we can give Ribavirin. If the name of the drug has VIR, you can bet the rent money that it's antiviral. Prevention is better than cure. So, how do we prevent measles? The MMR vaccine is live attenuated vaccine. Is it effective? Yes. Why is it effective? Because there is only one serotype for measles. Remember the measles that we talked about in ancient Greece and in the medieval era? It's the same freaking measles. It's the same freaking serotype. It does not change. And when you only have one serotype, it becomes easier to target this virus with a vaccine. Contrast that with the influenza virus, which has a whole bunch of serotypes. It's very difficult to make vaccines against all of these types of influenza, and when you make them, they are not super duper duper effective. On average, the flu shot against influenza is 30 to 50% effective. Now you know why. This is one reason. The fact that influenza has many serotypes, whereas measles only has one. Who should not get the MMR vaccine? If you're immunocompromised, why? Because this is a live attenuated vaccine, not a killed vaccine. If you're pregnant, why? Because pregnancy is a state of immunosuppression. During pregnancy, the mother becomes immunosuppressed. Why? To protect the baby, because the baby or the fetus growing inside the mother is foreign to the mother, immunologically speaking. That's why the mother has to sacrifice herself and weaken her own immune system in order to protect the fetus. Next, if you're allergic to gelatin or to neomycin, both are components of the MMR vaccine, you should not take it. This is not a comprehensive list. Let's summarize measles in 1 minute. How did I get it? Droplets, respiratory droplets. What kind of virus is this? It's an RNA virus. It's a member of the paramyxovirus family. It's a Morbelli virus. It's a single-stranded RNA virus. It's enveloped, helical, non-segmented, linear, and negative sense. Symptoms: 3 C's and 1 P. Cough, coryza, conjunctivitis, and photophobia. The Koplik spots, the rash that starts maculopapular and then coalesces or becomes more confluent. The rash is called rubeola, by the way. Fever. Complications of measles include giant cell pneumonia, the most common cause of death, bacterial superinfection, diarrhea, post-infectious encephalitis, and subacute sclerosing panencephalitis. How do we diagnose measles? Clinically, reverse transcriptase PCR, serologically by looking for the IgM and the giant cell in the lymph node. Treatment: vitamin A, supportive care, immunoglobulins, especially if you're immunocompromised, and treat the complications. And if you're an adult with a very severe infection, give Ribavirin. Do you want to learn about Ribavirin and the other antiviral medications? How about the antibacterials, antifungals, and antiparasitic agents? You can learn about all of these by downloading my antibiotics course on my website medicosisperfectionalis.com. If you value what I do, help me make more videos by supporting the channel. Go to buymeacoffee.com/medicosis. There are more than 750 premium videos available on this channel if you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.